spiritual, and family care needs. You will ask this when you first meet the patient, and it is also in the assessment booklet on page 1. On the transfer of care letter, there is a heading, Outline the person's current spiritual and family care needs. Note, it is documented that Sumira is a Hindu. Mention the specific religion and also if they have asked to see a religious leader, such as a cleric or rabbi. The chaplain can be contacted and they can minister to them and their family and or support or be able to find a religious leader within their faith. The Royal Marsden's Manual of Clinical Nursing Procedures says we must consider the person's values and beliefs. The person's values, beliefs, including spiritual beliefs and goals that guide their choices or decisions. According to the model, there are 5 factors that influence the activities of living. The incorporation of these factors into the theory of nursing makes it a holistic model. If they aren't considered, the resulting assessment is incomplete and flawed. The factors are used to determine the individual patient's relative independence in regards to the activities of daily living. The various factors are biological, psychological, socio-cultural, environmental, politico-economic. The biological factor addresses the impact of the overall health, of current injury and illness, and the scope of the patient's anatomy and physiology. The psychological factors addresses the impact of emotion, cognition, spiritual beliefs, and the ability to understand. According to Roper, this is about knowing, thinking, hoping, feeling, and believing. When considering the patient's spiritual needs and the family's care needs, this should be viewed in a broad sense. From the assessment, we know Sumira lives with her husband and her daughter lives close by and is involved in her life a lot. She is a housewife and normally completes all the household tasks. We know she may now require input from her husband and daughter following the fall and head injury. It is a good idea to mention this here. Royal Marsden's Manual of Clinical Procedures, Professional 9th edition, Values and Beliefs, Religious, Spiritual and Cultural Beliefs. The aim is to assess the patient's spiritual, religious and cultural needs to provide culturally and spiritually specific care while concurrently providing a forum to explore spiritual strengths that might be used to prevent problems or cope with difficulties. Assessment is focused on the patient's values and beliefs, including spiritual beliefs, or on the goals that guide his or her choices or decisions. A patient's experience of their stay in hospital may be influenced by their religious beliefs or other strongly held principles, cultural background, or ethnic origin. It is important for nurses to have knowledge and understanding of the diverse cultures of their patients and take their different practices into account.